My name is Jules, and I am a Protect Purdue ambassador. As ambassadors, our job is to educate both students and faculty on the importance of upholding the Protect Purdue pledge in order to keep our campus safe for everyone. In the following videos, you will see different aspects of our campus and how they are set up in order to meet the CDC guidelines and provide a safe environment for those on campus.
Currently outside the Wilmeth Active Learning Center, you can see that students are wearing masks as they transition from in-person classes. This is the new normal here on campus. Students are very willing to adhere to the Protect Purdue guidelines to ensure we can continue an in-person experience this fall.
We're now here outside of the Neil Armstrong Hall of Engineering, and you'll see one of Purdue's many advertising signs taking every small step to protect Purdue. The Office of Marketing and Media has done a fantastic job making sure this message is heard loud and clear by students, faculty, and staff, to making sure that everyone's doing everything they need to do to be here this semester safely and protect Purdue together.
Currently, we're in the Mechanical Engineering building, and right when you walk in, students have the option to stop at the sanitary station, which has hand sanitizer and protective face masks.
This is one of the many dining tents scattered across campus. There's one at each dining court. You'll notice this one is actually behind Ford Dining Court, where President's Council tailgates typically take place this time of year. Each dining court is equipped with a ton of different tables. Each table has 4 seats at it. Each seat is separated by plexiglass barriers, so you still have the ability to talk to your friends and talk to your fellow students, but doing so while keeping a safe distance and getting a great meal in as well.
So this is one of the study lounges in Meredith South. As you can see, all of the furniture is at least 6 feet apart so that people can study here without breaking the protocol. And this is my friend who is 6 feet apart from me, but we're still wearing masks.
Currently, we're inside the Wilmeth Active Learning Center, where students are wearing a mask as they study. Currently in the Wilmeth Active Learning Center in classroom number 1018. You can see the signage on the doors to ensure that students adhere to the Protect Purdue guidelines. As we make our way over to the corner of the room, you'll see a tub of sanitary wipes. Students are to wipe down their desks before they sit down and when they're about to leave. As we make our way over to the classroom setting, you can see the yellow markings on the floor to ensure that chairs and tables remain at a safe distance. As we go forward to the front of the room, you can see the plexiglass that's used to protect professors and students for an in-person class experience.
This is one of Armstrong Hall's lecture halls. So as you can see here, on every other desk, it says correct social distancing and incorrect social distancing. So when the students come in, they're going to take a wipe, they're going to wipe down their area and sit on a seat with a yellow sticker and leave the black stickers empty. So this is one of the dorm rooms in Meredith South. This is a double. So our beds are placed far enough apart along with our desks. So we are following the CDC guidelines and social distancing while in the room.
Welcome to my apartment. I live in a residence off campus, so not on campus, but still taking all the necessary precautions needed. You'll see here I've got my many Purdue masks on the wall, as well as my Protect Purdue wellness kit that's distributed to every student. So even though I'm not in a dorm, I'm still taking all the precautions and necessary to keep myself safe and keep others safe as well.
Thank you for your steadfast commitment to and support of Purdue University. I couldn't be more grateful to be a Purdue student. I know that by creating the Protect Purdue guidelines, Purdue did the right thing, and because of that, many can receive an in-person experience this fall semester. Thank you for all you continue to do to support Purdue University. Boiler up, hammer down, and hail Purdue.
Good evening, everyone, and welcome to this special event, Protect Purdue, Conversation with University Leadership. I'm Matt Folk, the Vice President for Advancement and Alumni Engagement at Purdue University and the President and CEO of the Purdue for Life Foundation. It's my great pleasure to host this gathering tonight. You've been invited to this live virtual event because of your support of Purdue during these extraordinary times, whether it's through your standing as a President's Council member or specifically through your gifts to the Protect Purdue initiative. Your generosity and your faith in Purdue are making an impact in real time as university leadership, faculty, and staff work to make this campus safe and healthy. Provost Jay Ackridge has said that crisis can bring out the best in an organization, and we are certainly being called to put the strengths of our university to work. So we wanted to give you an inside look and a chance to hear from some of the people who are in the trenches putting the Protect Purdue plan in place. These are just some of the leaders who are bringing together the incredible ideas, the creativity, and the strengths of our university to make in-person learning and also importantly, remote learning possible this fall semester. And they're doing it with dedication and persistence. Private giving through your generosity is making the difference in times like these and providing the resources for success. I'd like to offer my personal thanks to each of you for your support of Purdue University. And now we'll begin the program with Eric Barker, who's the Dean of the College of Pharmacy here at Purdue. He's also a member of the Protect Purdue team with primary responsibility of overseeing the Protect Purdue Health Center. Eric?
Thank you, Matt, and good evening, everyone. It's always great to see a large group of Boilermakers on a virtual call, and we're very grateful that you've decided to spend a few minutes with us this evening so that those of us that have been involved with many aspects of the Protect Purdue plan and rolling things out here on campus, and as you'll hear a couple students share their experience, what student life has been like on campus this fall. We have had a number of questions that we have been submitted to us, and we're going to jump right into those in just a second. We have a group of esteemed panelists, and I'll introduce them as well in just a moment. But as we lead out, I'm going to share just a few slides with you. We've had numerous questions about the status of the numbers of cases on campus, how we are managing the cases on campus, how testing and tracing and all of the aspects associated with Protect Purdue have been going. And so what we're going to do is we're going to jump into some of those slides here right at the beginning. So this particular slide talks about the Protect Purdue pledge. There's a personal responsibility for protecting Purdue and our community. The responsibility that each of us has really starts with the Protect Purdue pledge, and we've really ingrained that culture into the campus. As you know, I'm responsible for myself, for others, and the Purdue community. We've done a variety of things around Protect Purdue, mandatory flu vaccines, which we're now in the middle of administering. The big strong culture around face masks, hand washing, social distancing, and all of the work that we've done to build a culture of safety. If you go to the next slide, please. So here, this helps describe the Protect Purdue Health Center, which I have been providing administrative oversight for. This is really the one-stop shop for Protect Purdue. And all things COVID related. We are managing all of the on-campus testing. We are managing contact tracing, case management. We have now built a team of nearly 100 healthcare workers that are working to manage the daily needs associated with the COVID cases on campus. As you can also see in the lower left, each student got a special wellness kit. Many have asked what kind of things have been purchased with the Protect Purdue dollars. One of those things are these wellness kits that were very important, have been very important with the masks and the contents to get the students off on the right foot. I'm also here, you can see Dr. Esteban Ramirez is our Chief Medical Officer. He has been providing clinical leadership for this team of about 100 healthcare workers that have been working to help our students. If we go to the next slide, yeah, there we go. We've made significant changes to our physical spaces. If you were watching the welcome video coming into it, you saw some close-ups of some of the things. We have tents all over campus. We've put distancing markers in the classroom. So there's much that's gone on in the physical spaces. We've enhanced airflow within the buildings themselves. So we have enhanced exchange of outside air and filtration of air as well. So there's been much done with our physical spaces, really to create the safe spaces for faculty, staff, and students on our campus. You can go to the next slide. We offer a range of informational and instructional options for our students. And so we'll have a chance to talk a little bit about some of what campus life and class life has been like this fall in a bit with some of our panelists. But again, we're pleased with the range of instructional offerings that we've been able to offer. Go to the next slide. We've really prioritized from the very beginning the need to protect the most vulnerable in our community. And so we have prioritized making sure that those individuals who may be at highest risk don't need to be on campus. And so it's been, I think, very effective for us as a priority as we've moved into the fall semester. The next slide. One of the key elements over these past few months has been the marketing campaign around Protect Purdue. And if you are on campus at all, you will see that the safety culture is ingrained just about everywhere you look. We're very grateful to our marketing and media team for a phenomenal job at conveying the safety messages on our campus. And so you'll see that the elements of this just throughout the campus and our culture, and it's really built I think within all our faculty, our staff, and our students, the necessary habits that we need for keeping the campus safe. We've also done a really good job, and I think you can go to the next slide, but we've also done, I think, a really great job of working with our community, and we have a very strong relationship with our health system and our county health department as well, and that's been a real hallmark of our success to this point. Our research labs are back open. They were some of the first in the Big Ten to get back up and running. We're very pleased with the efforts there and allowing our faculty and our graduate students and our research staff to get back to their very important work. We go to the next slide. And of course, we've tried to anticipate changes and contingencies. Obviously, there's been a number of things that we faced this fall. We'll have a chance to talk about some of those here in a few minutes. But while we've planned and we've tried to leave really no stone unturned, there has been no question that we've had to be able to adapt, and our plan is constantly evolving, and we'll have a chance to talk about some of that. But I'm very, very pleased with the way that so many people across campus have responded in a positive way as we have had to adapt to the fall semester. We go to the next slide. Talk a little bit about our testing protocols. We are using the testing here on campus. We did do an entry level testing, a reentry testing. Nearly 38,000, I think, tests were performed coming into campus. About a 0.7% prevalence rate of COVID as students came in. This allowed us to reduce the number of positive cases in the early part of the semester. And then we've shifted to a surveillance testing. And the surveillance testing now, we've done 33,000 tests on campus since August 1st. You can see we've had just over 900, and this data was, I think, from yesterday or Saturday. We've just had over 900 positive cases in the student population. We're running now about 5,000 tests a week, averaging normally around 25 active cases at any one time. Most of, if not almost all of this testing is being done here in the vet school at the Animal Diagnostic Disease Laboratory. And we're very grateful to the College of Veterinary Medicine for their support and have become a vital resource. And you'll hear a little bit more about that from Dean Reed in just a bit. Our surveillance testing is underway. We're trying to test at least 10% of the whole campus population per week. It's a mixture of those with symptoms, those that have had high-risk contacts with those that have been tested positive, and then serial testing of certain employee groups that are involved with core university functions, then random sampling of about 10% of the student population, as well as 10% of those employees that are working full-time on campus. And then lastly, the testing of anyone who who might need or request testing for a variety of reasons. And so I think we have good testing on campus. Our typical turnaround time is about 23 hours for a test result. Here you can see the public dashboard. I'm not going to cover the numbers. They are updated daily. There's a snapshot of total cases, active cases, cases and positivity from the last 7 days. And then if you were to go to the next slide, or if you were on the website, you'd scroll down and you would see the dashboard, which gives the numbers of cases, numbers of tests, and number of positive cases, and our positivity rate. And then you can scroll down and see a very important resource number. If you go to the next slide, there it shows our isolation beds. We have about 940 isolation beds available to us, and on most days we're hovering around 50 to 60 students that have really been utilizing those beds. So we have quite a bit of capacity that we have in our isolation space. And we know that many universities very early in August had underestimated their number of needs for isolation space and ran out of isolation space very quickly. What we have discovered, and we'll talk a little bit about this as we go forward, is that particularly students who are in university residences will oftentimes utilize our own on-campus isolation space. Many are choosing to isolate at home if they can go home, and that's understandable that parents would like to have their children home. But in some cases, parents would prefer not to have them home and let them isolate here on campus. And we have the capability to do that. And we've provided now good support in terms of food service and linen service and taking care of them there in our isolation space in the Purdue West Village, which is the old married student housing that many of you would be familiar with. So I think that may be my last slide. If you go to, yeah. And so we're going to just jump right over to our panelists and jump into a series of questions that we've received, and some questions that we will be receiving from you all during the course of the evening. And so I'm going to introduce our panelists. Our panelists include David Broker, who is the Chief Innovation and Collaboration Officer for the Purdue Research Foundation. And David has been providing overall oversight and leadership for the overall Protect Purdue plan. Dr. Willie Reed, who's the Dean of our College of Veterinary Medicine. Dr. Jenna Rickus, who is Professor and Interim Vice Provost for Teaching and Learning. And then we have two students with us who are part of the Protect Purdue Ambassador Program. We're very pleased to have with us Mitchell Demerly. Mitchell is a senior in computer science and economics from Avon, Indiana. And Anna Zolwinski, who is a junior in business communication from Cincinnati, Ohio. And so this is our panelists. Thank you all for joining us this evening. We're going to jump into some questions here and let our audience hear from you all. The first question we're going to take is, how is Purdue contributing to research and or vaccine development for COVID-19, and how can donors and alumni best support Protect Purdue? And I'm going to let Dean Reed comment a little bit on that one.
Well, thank you very much, Eric, and good evening, everyone. And it's nice to be able to connect with fellow Boilermakers tonight. I'm very proud of what Purdue faculty have done in the past 6 to 8 months in terms of research contributions to COVID. In fact, we have over 100 research projects at various stages of development and funding. And it involves many colleges across campus, including College of Agriculture, Education, Engineering, Health and Human Sciences, Liberal Arts, Pharmacy, Polytechnic Institute, and the College of Veterinary Medicine. If you look at the research that's being done, you can put it in various categories. One is in the area of diagnostics. And so we have faculty from pharmacy and engineering, ag engineering, looking at novel PCR-based and antibody-based tests for COVID-19. Also, in the area of diagnostics, we have faculty looking at measurements of inflammatory condition detection in the lungs, so specifically looking for cytokines, markers of of inflammation in the lungs. In the area of the therapeutics, we have faculty that are looking at the development of new antiviral drugs, especially novel protease inhibitors. These drugs will prevent viral replication. We also have faculty looking at the development of new drug targets to attack the virus from different means, and also drugs, therapeutics to help mitigate inflammation that you would find in the lungs. In the area of vaccines, we have faculty that are looking at really some unique approaches here, vector vaccines. This is where you would use a virus to carry specific genes of the COVID virus. So that's very innovative. We're looking at faculty that are developing subunit vaccines and other novel vaccine candidates. Other projects include projects in the area of epidemiology and modeling, also projects that are looking at managing COVID-19 related food security challenges in developing countries or around the world, and also mitigating COVID-19 impact here on the homeless right here in Tippecanoe County. So our faculty has really, they've risen to the occasion and really are making, I think, very important contributions to COVID research for our nation and for the world.
Well, great. Very proud of the work that our faculty, graduate students, and research staff have been doing in this space. And again, as the folks on this call know, one of the great ways that you can support Protect Purdue is through the Protect Purdue initiative that many of you have heard about. I'm going to take this particularly interesting question. It's about surprises. There's been a lot of surprises in 2020, and we're going to bring in Vice Provost Jenna Rickus as well on this one. But has anything surprised you about the school year regarding Protect Purdue? Jenna, any surprises?
Yeah, there's been a lot of surprises, as you sort of point out. Most of us have not done anything quite like this before, but a pleasant surprise. I think a lot of our instructors, a lot of us were worried about teaching in a classroom with a mask. And surprisingly, that has turned out to be not as awful or weird as we thought it would be. I mean, we get used to it, and you're able to do it, and the students and the professors can understand each other and interact and communicate, and it turns out to work pretty well. I think that was actually a big surprise. And then the other piece I think is a little bit maybe more profound, in that we were one of the first universities to really turn on in-person instruction during our summer program early in July. And most of us, as we were planning, rightfully so, were really thinking about the risks of in-person instruction, bringing people together, and really focusing on the protection and all the things that we were going to need to do that, rightfully so. But I think what a lot of the country underestimated, and what we've found here at Purdue and our peers like us that do have in-person instruction, is that it's actually turned out to be a real asset from a public health and the Protect Purdue strategy. And that is because, our students really value being on campus. They value learning together. They value being with their professors, being close to all the research we just heard from Dean Reed, and being able to even participate and contribute to COVID in that environment. And that's a real motivator, I think, for students. As we ask them to do a lot of things in the Protect Purdue Pledge, but they're gaining from that by being able to participate in in-person instruction and research and other things. And so I think that's been a big surprise, really, or at least in our thinking. Maybe it shouldn't have been, but it's turned out to be a big asset for us.
Dean Reed, perhaps from your perspective as a dean, any surprises this year?
Well, pleasant surprise, just how well our students have adopted to the changes. They have really embraced the Protect Purdue plan, and the compliance with wearing a mask, social distancing. It's been really good. And so I've just been very, very happy with how well and how flexible, how adaptable they've been and how flexible they have been and their resilience. There's something about the Purdue student that I think is very unique.
Yeah, I would agree on all of those fronts. And it's so rewarding to see how our students, and you're going to hear from Mitchell and Anna in just a moment, but they've done a phenomenal job. We have received a question about a sort of long-range planning. I'm going to bring David Broker in here. And we're going to talk about the spring maybe towards the end a little bit. But David, maybe comment a little bit about how far out we're thinking and how far out we're planning and spring semester, next year, what kind of stuff are we looking at beyond November 23rd?
Thanks, Eric, and good evening, everyone. Pleasure to be here. And again, thank you for all your support and contributions. We've when we look into 2021, I think it's, we just have to be realistic and practical that, this is going to be with us certainly through the spring semester and potentially into the fall semester of next year, just to be realistic and practical. As task team leaders, all of the task team leaders are reevaluating sort of the plans that were in place for the fall semester, looking at ways to improve upon those. And in the next couple of weeks, we're going to sit down as a sort of integrated set of team leaders and discuss what some of those changes are. So those will clearly be the things that we work on in the spring. But again, being realistic, I think we really need to think and look and expect to sort of what the new normal is going to be even through next year. Everything's going to really depend upon how well the vaccine rolls out, and it's hard to predict at this time what's going to happen there. So just being realistic, we really have to think about all of 2021 as being another Protect Purdue 3.0 plan.
There was a question about what is the effectiveness of the actions that we've taken so far, what's worked and what's not. And I will say, I think one of the things that we're very pleased with is that the systems that we've built to manage the cases on campus, the relationships we've built with our county and the local health officials and the local leadership here within both Lafayette, West Lafayette, and the county have been really beneficial to us. Our systems have allowed us to manage the cases on campus. We said early on, our strategy was about mitigation and suppression. Mitigate the number of cases, suppress any outbreaks, and through testing and our contact tracing and the Protect Purdue Health Center, we've been able to do that. I think early on we learned that there are certain groups of students, not by virtue of their behavior, but just their living arrangements, were at higher risk. 10% of the student population lives in congregate housing units, which we talk about. Congregate housing is really what you would think of as our Greek system or our co-op living arrangements. And what we discovered that while 10% of the students live in congregate housing, they're actually making up about 50% of our cases. And again, it's not because they're engaged in parties or behaviors that are particularly problematic. It's just a fact of the living arrangement in those houses that makes them at higher risk. And so we had to adapt very quickly to dedicate specific staff and individuals and resources to provide additional support for them to allow them to live safely together. And I think we've done a really good job now of getting most of the houses where they are able to live together. And while every now and then there's a house where we have an outbreak, overall they're doing a phenomenal job of managing. And so it's another example, I think, where we've adapted, but our systems are working to help us manage our situation. Along those lines, one of the questions that always comes up is about an infection threshold that would trigger closing or going exclusively back online. David, you want to comment on that?
Sure. As you mentioned, it's a common question. Do we have predetermined triggers? Whether that's infection rates or what's happening across the country or in our local county, and we really haven't tried to prescribe ahead of time what some of those triggers are. We look at it very holistically, as you mentioned. We look at infection rates certainly in the county and across campus. We review those every day. We have 8:30 meetings with President Daniels and 9:30 meetings with local health authorities to sort of review all of that information. So, what's the baseline levels of infection? Most communities are looking at trying to maintain a positivity rate of less than 5%, somewhere on the order of 5, if not less than 5%. And we've clearly been in that ballpark since we've opened. So I think from an overall infection rate, we're doing enough testing and we're identifying the cases. And as you said, the secret to our success is the ability to then, once we find a case, to isolate that individual and then do rapid contact tracing around them. And so, in addition to infection rates, we look at our ability to manage it. So how fast is our system responding? And I think you've already identified that, that Protect Purdue Health Center and the testing that goes through the ADDL lab, our goal is to be able to respond within 24 hours. And having what seems to be an awful lot of isolation capacity, almost over 900 beds, is something that we fortunately have not had to deal with probably more than 50 or 60 at any one time. But so when you look at just overall, all of those factors together, I think we're doing well. We never like to jinx ourselves. So we like to say we're in a stable situation, and that will continue.
I'm going to pivot a little bit here. There's a question that the state of Indiana is relaxing restrictions. And so I'm going to bring in Mitchell and Anna here. But what are we communicating or what's happening to student communications to make it clear that Purdue is not relaxing, our efforts, and how are we advising students to keep safe when they're off campus? And so Anna and Mitchell are Protect Purdue ambassadors. And Anna, I'm going to let you just describe what being a Protect Purdue ambassador means for this group, and then we'll ask you to maybe elaborate a little bit about how we're communicating to students about keeping their guard up.
Of course. So as an ambassador, we work directly with the Office of Marketing and Media to really understand and embody what the Protect Purdue Pledge means, and then to educate to our peers on campus what it means, how they should be following it, and kind of how it benefits us as students here on campus. So in regard to the question specifically, I think even though the state is relaxing the restrictions, I think that Purdue is actually, increasing the communication that we're having here on campus. So as a student, if you're walking around on campus, it's almost impossible to not be reminded of the Protect Purdue Pledge. So whether you're, walking around using the fitness facilities in the residence halls, there's constant messaging about it. And I think, at least from a student perspective, what's been really outstanding to see is that now the students are, taking this messaging upon themselves and conveying it to their fellow students. So whether it's, a student organization posting on Instagram pictures of their members wearing masks, or hosting an event that follows the Protect Purdue guidelines, I think it's been really special and unique to see that the students are now putting out the messaging themselves.
Mitchell, again, the state is opening back up, and how are we doing it communicating to students while the state's relaxing some of the guidelines? Campuses, it's full steam ahead.
Yeah, absolutely. Thank you, Dean Barker. So I think that students here at Purdue know that, yes, you're currently living in Indiana. Yes, you're in Tippecanoe County. But ultimately, first and foremost, you're a Purdue student. So students know when they're living on campus, when they're going to class, that they have to comply with the Protect Purdue Pledge. And students are all for that. Like Anna said, to echo a lot of her thoughts, it's not just the Office of Marketing and Media and Purdue telling students what they need to do. It's other students telling students what they need to do. And I think that is really the key aspect here, is that it's students telling other students, and that's how we're going to continue to be successful in taking these precautions at Purdue, even if the state is kind of relaxing restrictions a little bit.
Great. I'm going to jump back to Jenna Rickus and David Broker a little bit. The weather is starting to get colder, and some folks have asked what we're going to be doing as we are pivoting to ensure everyone stays safe, and what kinds of activities are we allowing? How are we shifting dining? How are we shifting other things as the weather is going to shift?
Yeah, well, we're really we've learned a lot from our classrooms, and the places where we've had a lot of indoor activities and the layers of protections that we've put in place, and to be able to observe how that's played out and to be able to protect people. And so that has allowed us to begin to open up more student organization, other study groups and things inside, and to really replicate and use those protocols in other student arenas that are maybe a little bit more fun and student led outside the classroom. In addition, dining is adjusting. One thing that's important, I think, to know is that, the university, we really adjusted our space utilization. And by taking some of the other things away, with visitors and conferences not happening, it really allowed us to prioritize all of our space for really core activities around students. So classes, studying, and dining. And dining is right now also adjusting. And I think we found we didn't depend on our outdoor tents quite as much as we thought we were going to have to. It was nice to have that window when things were warm to learn, but I think now we'll be prepared and to move some of those things inside and into a phased and adjusted plan.
David, anything to add? And as we head into the colder months?
No, not really. We've been very, very fortunate with the weather that we've had this fall. We've done a lot of outdoor activities. For example, we've had movie nights on Friday nights and Saturday nights. And it was great. Well, we could do that on the football field and watch it on the Jumbotron, but now the football team's coming back, so we're moving back to Slater Hill and finding other places. I think, we're going to try to figure out, can we do something, for example, in Mackey Arena for movie nights, like on Friday and Saturday. And so using as much of the spaces as we can to find appropriate activities for the students, not just in the classroom. And then, I think key to this is just going to be continuing to educate ourselves with signage and just reinforcement. Both ambassadors mentioned it, and I think this is actually one of the strengths of our programs is the positive reinforcement everybody gets from one another. So it's just a matter now, I think, of communicating where some of these spaces are and how we can use them once the weather turns cold.
Agreed. I'm going to jump back to Dean Reed. And I've mentioned that our testing is being done at the ADDL lab here in this College of Veterinary Medicine. And there was a question about testing tools and utilizing ADDL within the vet school. So Willie, maybe give us a little bit of update and your thoughts on testing and how things are going down at the ADDL lab and the vet school.
Sure, happy to do that, Eric. And for those of you who may not be familiar with the diagnostic laboratory, the Animal Disease Diagnostic Laboratory is what we call a full-service veterinary diagnostic laboratory. It actually is it's a collection of laboratories. We have the capability for testing in the area of infectious diseases and microbiology, extensive pathology service, toxicology service. And the laboratory is very used to providing high volume testing, for animal diseases. And the tests that we run for animal diseases are similar to or the same type of technology that we run for human diseases as well. So we were able to acquire the proper certification in order to provide human testing. Is called CLIA certification. David Broker helped us with that, and so we've been running COVID testing now for several months. It's done in our molecular section. We run the PCR test, which is the gold standard, and the test is run on either nasal swabs or saliva samples. And as Eric mentioned a few minutes ago, we're running about 5,000 tests here on campus each week. And this is an incredible resource that we have here on campus that many universities do not have, a veterinary diagnostic laboratory or a diagnostic laboratory capable of running high volume molecular testing.
Again, we're very grateful for the lab staff who have been really outstanding. David, did you want to jump in?
Well, Willie's being modest about his group over there in ADL.
Yeah.
You know, we literally in 11 business days and 26 minutes after we filed for our CLE application, we got approval, and that's really a testament to the caliber and capabilities of that lab. And while we've reported 33,000 tests on our scoreboard, they've done many, many more than that, obviously, since the May timeframe. They were also we were the second university to adopt saliva testing. And Rutgers was the one that really pioneered that work, but we were the second university. And so when you add all of those kinds of things together, I really think it's a testament to Willie and the staff over there. So Willie, you need to pound your chest a little bit more.
Okay, I'll toot my horn more. Okay.
Okay.
I'm going to jump back over to Jenna now, and let's talk a little bit about what in-person classes have been like, and maybe a little bit about how we've been holding in-person classes. Is there a plan to have more in-person classes perhaps in the spring, and just kind of what your thoughts are on where we are with teaching and learning?
Sure. Yeah, so there are many layers of protection, and really every aspect of class had to be rethought. So, you saw some photos of our classrooms in the video, and our facilities and architects teams over the summer literally mapped to the inch, nose to nose, seat to seat, arranged furniture in all 1 million of square feet of our classrooms across, and that was just step one. We invested a lot in technology upgrades. So, you heard about students needing to isolate and quarantine. Well, if they're going to be out of the classroom for, 10 to 14 days, they need to be able to continue with their courses. So, making sure all of our classrooms were up to date and up to speed for what we have a system called Boilercast, which is a lecture capture, which can capture video and live what's happening, can live stream as well as capture for later recording for those students who couldn't be there because of COVID in the classroom. So just many, many layers, all of our protocols, attendance policies to make sure that students could do the right thing and could really continue in their courses. We launched an academic case manager program, which we think is really the first of its kind, which is a student success and support system, one-on-one coaching for students, again, as they have to step out to quarantine because of contact tracing or isolate because they've tested positive. And so just really had to rethink. We had to put in place new absence letters and notifications for all of our instructors, so many things. And so the classrooms, our priority was really to do as much in-person instruction as was possible. You also have to consider not only the distancing, which just fitting in space, those social distancing takes us down typically to about 50% capacity in a classroom. So having to really rebuild the entire schedule, and some things just don't fit properly. So we had to redesign and re-engineer a lot of courses to just even fit into the spaces under these new constraints. And of course, protect instructors who either due to medical conditions or other things are particularly high risk. So many factors were, and students as well. So we also launched a fully online option program for students who either couldn't get here because of travel or visa restrictions. Some of our students are still around the world and in literally every continent, and haven't been able to return to us since the pandemic again. So as you can see, many, many things about our classes are different. Our priority has always been to get as much in-person and engaging instruction as is possible and is safe, and we'll continue to optimize and learn how to do that as we move into spring.
I want to bring Anna and Mitchell in here real quick, and maybe you want to weigh in a little bit about how the students and how, from a student's perspective, you all feel you've adapted to the new normal of what learning is like in this environment. How stressful has it been, and maybe just give a bit of a student perspective on this.
Yeah, I guess I can go first. I think, like everyone in the world right now, students are adjusting to the current circumstances. In terms of learning, like Dr. Rick has said, there have been a lot of changes, but I would say that a lot of those are advantageous in some respect. So if I go to my lecture from my econ class on Monday, it's recorded for the students who aren't able to attend, and I can go back and watch it too. I can go back and take my notes. So I think when coronavirus is all said and done, eventually, we're going to come out of this with a lot of new teaching methods and a lot of things that we've discovered are beneficial for the student body and beneficial for faculty to continue doing. So it's not been easy. It's been a challenge, but Purdue is doing a really good job of, like Dr. Rick said, providing all the resources necessary for students to succeed in this changing environment.
I'll go ahead and kind of add on to what Mitchell said. I would agree wholeheartedly, and I think that this situation has also really created some beneficial and meaningful relationships in between students and professors. So to give you an example, in one of my classes, my instructor biweekly has kind of a wellness check for us as students. So we finish with our academic content, and about the last 10 minutes of class, she hosts a wellness check. And it's a really great opportunity for us as students to connect with one another, to hear about what we're doing, how we're feeling, how we're coping with the virus. And I think for some of those students, that may be the only time that they have that interaction. If they're not on campus or if they're not leaving the residence halls, I think it's a really great way that students and faculty are really coming together to face this challenge that we're all having to deal with. And like Mitchell said, I think a lot of good can honestly come out of this situation, and we can learn how to adapt to situations like these in the future.
In terms of well-being, student organization involvement is really important. Student leadership development is important. What kinds of things are going on campus and how will those experiences, are they being created safely during these abnormal times?
Sure, I can speak on student organizations, and I'll let Anna kind of speak on maybe some other experiences on campus. I'm a part of two main student orgs here at Purdue. One of them is meeting entirely virtually for this semester. Another organization is meeting in a hybrid approach. So both approaches work equally well, and they both work to incorporate all students, no matter if you're off campus doing the online option, are on campus, or if you are quarantined because you've been exposed to COVID-19 or have COVID-19. So I think that organizations are absolutely being challenged. I think that's kind of a buzzword of the night, is a challenge. But that adversity is growing them and developing them as leaders. Your Boilermaker experience would not be what it is if you were not challenged and the time you were here. And it just so happens that right now, for some students, COVID-19 is that challenge. So the way that student organizations have been able to adapt their plans and their events to the current circumstances, I believe will really not only just develop the organization, but develop the students as leaders and as impact makers as well.
Thanks for sharing that, Mitchell. I think I can kind of talk about student life on campus in other areas as well outside of student organizations. So I'm actually a group fitness instructor at the CoRec, which is our fitness facility here on campus. And so it's really outstanding to see the CoRec and Purdue Recreation and Wellness and other student life organizations like that still providing those opportunities for students on campus. I know as a student returning this fall, I obviously wanted to be here, but was a little apprehensive about what campus life might look like. And so it's been really refreshing to still have those in-person fitness classes or intramural sports. Sand volleyball is coming back again. Student organizations hosting events on Croc Lawn, other, games going on outside. And so although I think we all came back to campus a little worried about what it might look like, we're constantly adapting. We're constantly changing with the times, changing with the new research, finding new ways to keep students engaged, especially as we move into the winter months.
Well, I'm going to pivot over to a different topic, and one that I know is of great interest to the folks who are watching tonight's presentations. And that is around Purdue athletics. We know football's coming back here at the end of the month, and basketball season will be right around the corner. We've got a number of questions that have come in about our intent or allowing to resume attendance by limiting attendance, spreading attendees out in the venues, why no students allowed at the football games, and what will happen with basketball. So I'm going to bring David Broker in and maybe let him comment a little bit about where we're at and maybe where we're going.
So, a lot of this is unfortunately beyond our control because of the conference that we belong to. Obviously, a lot, the Big Ten football at least postponed their season, and then they obviously restarted it again. And there's obviously a lot of protocols in place to not only test and do contact tracing with the teams, but also with regard to what practices look like and what, game day activities look like and what you can and can't do. So I think, in the interest of starting cautiously, I think people want to, sort of get our first football game or two under our belts and then see where we might be able to go from there. It's very similar to what Anna and Mitchell said that, we started the academic year very conservatively. We didn't know exactly how things were going to evolve. And now 7 weeks into it, we're able to make some adjustments and accommodations and open some things up. So I think the same thing hopefully will happen with athletics. Where we start the year might not be the same place as where we end the year. So we're constantly working not only with our athletic colleagues, but also the county. The county has to weigh in on anything that we do with regard to gatherings of over a certain size, and clearly football and basketball games would fall into that category.
Thanks, David. And so I would just tell folks to stay tuned, and you'll hear as the conference makes any recommendations for changes. There's been a number of questions that came in about the financial picture of the university, and I did have a chance to talk to Chris Rule, our CFO and treasurer, and the university budgeted about just over 60 million, I think 63 million for this fiscal year for the Protect Purdue initiative. About 52 of that million is what we had anticipated spending out of our own budget. We're running about 60 million, instead of 52. So we're about 8 million higher than we had anticipated, largely being driven by unexpected needs at Purdue West Village. Again, those of you who are familiar with that space know those are older buildings, and they did require some investments to make them highly usable, especially around air handling. And HVAC enhancements in our buildings on campus to increase air exchange and filtration of air on campus, the number of tents, the study tents, the dining tents on campus, as well as all of the PPE and disinfecting and cleaning protocols, as well as contractors to assist with all of that. Testing and tracing has been about 40% of our overall budget. And again, as I said, we've got about 100 healthcare workers now working for the Protect Purdue Health Center. The modifications in the classrooms, the distancing, the quarantine space. We do typically run a small surplus in our annual budget. This year, our plan was to run a break-even budget, but we've helped to manage those additional expenses by deferring merit pay increases and reducing expenses in things like travel, as well as overall expenses to absolutely essential items only, and really having a hiring freeze. So as positions remain unfilled, the savings from having unfilled positions. And so the combination of proactive financial decisions early in March and April, I think helped set a stage where we're managing okay. But again, right now we've anticipated to this point that we've spent about 60 million of our money. There'll be about another $11 million that came from the CARES Act funds. So about 71 million gross have been spent on Protect Purdue. Again, 100 staff at the Protect Purdue Health Center, $4 million was involved in the test stall as we returned to campus. There's about 5 miles of plexiglass that have been built and used around campus. And we're now cleaning about 2,800 spaces on our campus every day. And so there's an extraordinary effort going on campus to keep the campus clean and safe, and allow us to maintain and continue to fulfill our mission as a residential land-grant university. And so I think that sort of sets the stage. But again, we're hoping financially, we're hoping to be about a break-even budget. But again, the support that you all have provided in so many ways, particularly for the Protect Purdue initiative, have helped cover many of these unexpected costs that the university has incurred as we've adapted to the pandemic. I want to talk maybe just a little bit about spring semester, and then I think we can wrap up. So we're going to jump to a series of questions on spring semester. And I'll bring in maybe Jenna one last time. Any changes that we're anticipating for the spring, more face-to-face instruction, and students were fully online, can they come back to campus, and kind of where are we headed with spring?
Yeah, so our spring strategy looks a lot like fall, however, with a lot of refinements and improvements. So better utilization of space to get more students into class more as possible. And there are limitations. A lot of it is really around space utilization. The fully online option, is we launched that, really starting early in the pandemic. We realized many of our international students were not going to be able to make it back, and our incoming students. And so we've been really hopeful that a lot of them could get here by January. And so some will and some won't. So we're continuing the fully online option, and we're looking forward to welcoming back as many of those, and some for the first time, to campus. Some of them had to start their first year from a distance, and many of them are very anxious to get here. As well as some of our students who, for medical reasons or others, couldn't be here. They will be able to continue in the fully online option as they need to. But we are really looking forward to welcoming students back as we always have new students that start in January as well. So we'll have brand new Boilermakers who, depending on their travel and their medical and other needs, will have the opportunity to opt in to that fully online option as well. So it's a lot of refinement. We learned a lot, and so we're building and optimizing, really, as I would say, what spring is about, and getting as much engagement as possible and as we can do safely as we continue to manage this pandemic on campus.
One last question was whether or not students would be required to submit a result of a COVID test before returning for spring semester like we did in the fall. And here in the next week or so, we'll be making that announcement. Yes, we will be doing another a massive test stall coming into January 19. We are exploring new potential technologies, and we really do anticipate utilizing the newer rapid antigen type tests as we move into spring semester, and we're evaluating availability of those tests as well as reliability. And we'll be bringing on the newest technology to our testing capabilities to supplement what's going on down with the ADDL lab as well. So students should anticipate, parents should anticipate that everyone coming back to campus in January is once again going to need to show proof of a negative test or fulfilled a CDC protocol after isolation. So we'll be monitoring that. But again, we've learned a lot this fall semester. There's a lot more for us to learn. We have a lot more time left here on campus. I think we still got 6 weeks, maybe 7. I'm losing track of weeks, but we still have a lot of time.
Week 7, day 1, Eric. Week 7, day 1.
Day 1. Not that anyone is keeping track, but we know that we've got a lot of work to do. But just so that the folks on this call know, extraordinary hard work by our faculty and staff to get us to this point. Incredible dedication by the Purdue Boilermakers and the students on our campus. And I think it was Dean Reed who said this: I couldn't be prouder of the students of Purdue for the way they've responded at so many levels. And so as alumni, I hope that you're proud of your institute, your alma mater. You should be very proud of the students who are here. They've done a phenomenal job to get us to this point, and I'm confident they're going to continue to be dedicated as we all work together to protect Purdue. Thank you for joining us. I'm going to hand this back to Matt Falk, and again, thank you for your continued support of Purdue. Matt, back to you.
Thank you, Eric and panel. I really appreciate it. Really appreciate you getting with us tonight. Thank you for everything you're doing to help protect Purdue. Big thank you to our alum and friends for their continued support and for joining us this evening. With your help, we've raised a little bit over $3 million in funding on 5,500 donations to offset some of these costs that you heard about tonight. Thank you to our students for working so hard to keep campus open and operating on a full-time basis. And lastly, upcoming events for you President's Council members and alum, please stay tuned for virtual homecoming news. We'll be celebrating from a distance November 9th through November 14th as we lead up to the Northwestern football game that Saturday. And as always, boiler up and hail Purdue.